as our hospital have been accredited 3 times by Joint Commission International, which is the most famous accreditor organization all over the world. When they will come, they have an idea about what is the minimum knowledge and the skill of the staff who have worked in those hospitals submitted for accreditation. In any hospital, this is the first strategic plan for Prince Sultan Medical Military City 2013-2016. We apply it for the JCI, and any organization has to focus on the vision and mission they are working for. This is the mission and vision updated 2020. Last, we submitted to the Joint Commission. Our vision is to be a center of excellence in the provision of integrated healthcare and global leader in scientific and research field. We can reach this vision by doing and clarify our mission. The vision is where we are going to plan to be. Mission, what is the way, what we are going to do. Prince Sultan is committed to provide primary, secondary, and tertiary and special healthcare service in according to the international quality standard, according to the MSD, Ministry of Defense, for the staff, MSD staff families, and other eligible categories, by providing excellent working environment, attracting the best human resources in Saudi and all over the world, to promote a culture of teamwork that will help those in healthcare provision. The vision and mission of any organization has to be well known for all staff. Sometimes in those JCI accreditor, when they will come, they ask the staff, do you know the vision of your hospital? Where she want to be? What is the mission currently? You are working in this hospital, so the vision mission has to be well known to all the staff. It is announced everywhere, but unfortunately we didn't usually go through or have a look about it. This is the vision and mission of our organization. The vision and mission to be applied, they put what is known as the strategic plan. The strategic plan is a strategic goals. We put strategic goals for any organization, and then we will use what is known as a prioritization matrix. This is the first tool you will look at. They put the goals, the strategic goals in a list, and then they score those goals according to criteria about the volume of that goal, about the risk of the problem that it will be solved through working on that goal, by the cost, by the potential future cost saving if this goal have been applied, by the relevance of that goal to reach the mission and help in the mission and vision. If it will have a good relation or a high relation in between the goal and the criteria, they will put 9. If it is medium relation, they will put 3. If it is low relation, it will put 1. So increasing the cleaning level of the organization, it is related to, if it is a big volume, yes, it is a big volume. If it is a risk, it is medium risk. If it is cost, it is medium cost. If it will potentially future cost saving, the cleaning will not make too much saving in the if it will be implemented. So it will give 3 irrelevance to the mission and vision. It is only taking 1 because it will not have a good impact on the vision and mission. And then we will sum all the scoring of that criteria and put it as a priority score, and we will look at the priority score of all the goals to find out which goals that have high score that we will start with, because in any organization there is no resources to achieve all the goals at the same time. So they will prioritize the goal according to certain criteria, and then they will focus on that goals in this coming 3 to 5 years. And this is the way, using the prioritization matrix to prioritize any list of items through using scoring system, using the tool. First tool we face is prioritization matrix. Then, according to the scoring system, the prioritization of our hospital is improve quality of service, improve volume of service by increasing the number of clinics, beds, and expanding of the emergency, improving the level of hospital information system, the IT system. Then for the periodic preventive maintenance, to keep our equipments, the medical and non-medical equipments, working at optimum. Improve the supply and the storage chain to prevent any shortage of any supply. These are the goals that have been the highest score in the prioritization matrix of the strategic plan of our organization in the coming 3 to 5 years. This is how to put a vision, mission, prioritization matrix of the goals by the highest level of the organization. Then they will ask about some points that GLD means guidance, leadership, and director. We have in the JCI standard, what is the standard and what is, let us discuss what is the standard and what is the criteria. To have us accredited by any accreditor organization, you have to go through the standard. What is the standard? The standard is the ideal way of doing the job. Globally, they does not rely now on try and error. They put down a standard way of doing any job. In all the activities, in our daily activity, there is a standard timing, there is a standard way of doing the service in healthcare, and every organization, accreditor organization, put a group of standard ideal ways of doing the job, that if you want to be accredited by that organization, you go through the standard. They will come to ask for to what extent you are committed to that standard in your daily activity. So those standards that's suitable for your industry or your daily activity, go through it, and if you find that it will be suitable and going on hand with your prioritization goals, apply for that accreditor organization. There is, we can discuss it later, but we will discuss only those most famous 3 chapters that when they will come, they will check to ask general questions about quality, directorate, and international library of measures. They will ask how your department measure that hospital-wide goals have been applied by your departmental level. Your hospital prioritization is focused on the periodic preventive maintenance program. To what extent is this is applied in your department? Do you have a periodic preventive maintenance program about the equipment you have in your clinic? Did you follow? Because this is a applicable part for the hospital-wide prioritization goals. What was the impact of the department improvement on the efficacy and resources used at the departmental level? Did your department put a plan about how to order the supplies according to your needs, that it will suit the service in at a high level, that there is no over storage and there is no shortage when some items is needed or not? Are you following the application of Prince Sultan Medical Military City adopted clinical guidelines, and what are they? What is the clinical guideline that you apply in your daily practice? If there is in endo, in resto, in implant, you are applying some globally known clinical guidelines. Yes, what is it? What is the Prince Sultan adapted, and show me where can you find these clinical guidelines as a document, and to what extent you are committed to. What is the priorities of your hospital? How is this daily activity going in hand with that priorities? What is how you can follow the prioritization of the hospital-wide in your department? How you make a key performance indicator, KPI. You are going to follow the activity of your department through KPI. What is the KPI that you are following? That your activity, the most important risk, high volume areas you are following at the departmental level. Do you have a regular meeting with the staff to discuss what about the most important activity areas, and you are following that problematic area through key performance indicator, and you are following the result of the improvement that you improvement plan that you choose to overcome these problems at your department or not, to achieve your performance and improve it, to go in hand with the hospital-wide prioritization. These are those questions that you need to follow. So, are there any regular meeting in your department? And any regular meeting, so long as it is done, it has to be, there is agenda, there is attendance sheet, and there is documents that have been, what is the issue discussed in that meeting? Are you following the result of the improvement in your department, in the solution that you have put? What are the results? Because a phrase is often used in our medical field that whatever is not documented has not been done. So even though you have a meeting with your colleagues, with your head of division, or if you are a head of division with your colleagues and subordinate, if those meetings have not been documented in agenda, attendance, and what have been discussed, it has to be documented, to be shown as there is a regular meeting at the divisional, departmental, hospital-wide level, discussing all the problems and how to be improved in a quality improvement project. So quality is a daily activity to be followed up in your work. Are there is regular meeting? The answer usually or the ideal standard is that there is a weekly, at least weekly meeting with all the staff with their supervisor to discuss what is the activities in the last week, it has been, what have been achieved, what not, what is the obstacle to be overcome. And on monthly basis, there is a departmental meeting for all the staff headed by the head of the department to discuss what about the results of the key performance indicators, those indicators that have been following the quality improvement problematic area in our department. And these all meetings have been attended by the staff who have been assigned to attend, and there is a documented agenda meeting have been done with the discussion items and the assignment for those who have assignment till the next meeting. How this key performance indicator have been chosen. There is in GLD 11, standard number 11 of the guidance, leadership, and director. The measurable element number 1 is what measures do you collect that are specific to your department or service area. If your department have been chosen the infection control measures for the tools as a most problematic area in your department. So the commitment of the staff to wear the preventive gloves and the mask and those in protective measures to be followed. To what extent they are committed. It is this KPI for infection control. If it is measured on weekly basis, they discuss that we are committed by 78%, 80%, 82%, and our goal is to be committed more than 85% because sometimes we find some staff roaming out of the clinic with the gloves and mask, and it is not supposed to be going out of the clinic with these gloves, not to spread the infection from in out or from out in, and it has to be taken donning or doffing. There is some regulation for those items. So what are the measures do you collect that are specific to your department? Measurable element 3, how did you pick your measure? There is international library of measures all over the world that you can pick some measures globally applied to the certain items, because we will not go to invent the wheel from the start. We are following those key performance indicators using globally. And do any measures from the library related to your department or service? If yes, have you selected any measures from the library? And we will show what we will show you in the next slide from where you can get this international library of measures. Regarding what is the KPI to be chosen, I have chosen the according to the risk of that key process to the patient, how effective this daily activity impact on the service, what is the cost of that service, influencing process related to it, the time to apply this improvement, and the resistance of workers to be applied. And we will discuss how to choose and what is the scoring, how to prioritize when we are going to go deep in prioritization matrix in next meetings. This is the specification manual for national health care inpatient quality measures. There is global for inpatient measures, outpatient measures, dental measures, surgery measures. All the specialties have their own clinical library of measures that if you click on any of this, you will find a list of measures. You can choose what is the measures related to your daily activity, where you will put these measures according certain criteria, and you will score it as we have seen for the hospital-wide prioritization. And the scoring will be 1, 3, 9 according to if it is very effective or very related to the patient complaint, medium relation to the patient complaint, if it is highly effective in patient complaint too much about this issue. These are the criteria, and you will put 1, 3, 9 according to the relation of the criteria to that item. And then generally, you will put down the name of your measures that I am collecting data regarding infection control commitment by using this protective preventive equipment that doctors and staff are using in my endo department. The one who will be responsible about this project, quality improvement project, will be Mrs. Lily. We choose it because the infection control have a higher priority in the organizational level, and it will be very crucial in spread of infection to our staff and patient. We will start to collect this data from the date of March 2021. It will be calculated by the number of staff who are fully committed doing and offering procedure of the PPE equipment to the total number of the staff who are using this PPE instrument. It is a process measure, and we will collect the data concurrently on weekly basis, sometimes in the first session 8 to 12, and sometime in second from 12 to 4, to be fair in collecting the data of the commitment of our staff to use PPE. And then to what is the sample size of your data, either to collect 50% of staff, 75% of staff, or all the staff. It is up to you. Where you will collect the data in the outpatient clinic of endo clinics. I will collect the data and I will analyze to what extent they are committed by calculating the number of staff who are committed to all the number of staff followed. And I will collect the data on weekly basis, and I will send it on weekly basis in the form of line chart to the head of the department and a copy to the infection control to follow up what is the commitment of the endo staff, for example, about usage of the PPE in the dental clinic. And then if I will find it not reaching the target by following up those data, I have to discuss it on regular basis in our meeting and to find out solution. What are the causes of non-commitment of using this infection control, and how we can put down the solution in practice to be fully committed more than the benchmark, which is almost, we will put it here, the the target or benchmark to be committed more than 85% or 90% of staff committed to the infection control measure. This is what is called another tool. We have discussed the prioritization matrix now, data collection plan to collect data regarding the measure. What is the measure? The measure is a specific follow-up tool to detect to what extent we are committed to a standard. What is the standard? It is the ideal way of doing the job. We got it from the standards that have been given through the accreditor organization. How you can collect the data is if the data is not observed and it will be extracted, to what extent is our documentation in the file. So you will go through the file and you will use a check list. So you need not observational, it is a checklist usage. This is one of the checklist as a data collection tool could be used. Then what and how you are going to follow your quality daily to-day activity. I will choose a KPI according to the prioritization of the importance of that problematic area in our daily activity. Then I will choose what type of data that I am going to tool, either observational or I am going to design a checklist to collect the data. I will train those people who are going to collect the data, how to collect the data, how to fill the checklist, and then we will collect the data by two teams and we will check the result of the two teams to be sure about the validation of the data that have been collected by the two teams to find out if it is identical. More than 90% of the both teams collect the data with the same result. It does mean the tool of the data is valid and we can rely on the data collected by this tool. And then we will evaluate to what extent is our problem and to what extent our improvement solution is effective by following up this measure or key performance indicator by time. This is the way of data validation between two teams. They collect the same data by two teams and will find the data are the same except one. So the validation is 96%. So the tool is well known and used in the right way. So we can rely on the data collected by that tool. So the next, what about the KPI result? Are there is any measure you currently collecting are applicable to your day-to-day activity? Yes. How are staff involved in quality decision and the resulting quality activity? Those KPIs result have been discussed in our departmental meetings and posted as a graph in the quality board in our department, and all the staff known about to what extent our solution is effective in overcoming the problematic area that we have in this KPI. So all the staff are involved in quality decision during the meeting. How do communicate quality information to staff? Through meeting, and we posted the result of the key performance indicator result on the quality board. How does the quality staff support you in your quality improvement program? There is a quality team following the quality improvement, and this is the quality culture that has to be well oriented. All the staff who has worked in a quality accredited hospital. The question to all the staff: what type of training have you received in quality improvement and patient safety, and when? There is always announcement from the quality division or quality department in our hospital about meeting and courses every now and then, especially condensed courses before the time of accreditation. And there is an ongoing program of quality education. Did you participate in such training? Yes or no? Supposed to be yes. How is quality improvement and patient safety information communicated to you? Through our regular departmental meeting, and I have seen the posted KPI follow-up graph posted in the quality board in my department. Do you feel you understand how your department perform in comparison to peers? Yes, there is usually a hospital-wide key performance indicator will show you to what extent the dental center is committed to the hospital-wide prioritization, such as infection control. It is hospital-wide, so there is comparison in between different departments, and you will find out this hospital-wide KPI in your quality board. Is your department or service adequately supported the quality improvement and patient safety efforts? Yes. Here in the dental center, they arrange these quality club to improve the knowledge and the skill of the staff who are interested. Is there is coordination and integration of quality improvement and patient safety activities between similar clinical areas? Yes, because at the higher level, all the heads of the department have a weekly meeting with the dental center administration to discuss the quality issue, and the dental center.
تخيل تو قاعدة أشوف جامعة الدمام عندهم فاتحين هذه السنة ماجستير في صحة البيئة. يجنن صحة البيئة، بس الدمام مش ودينا، بس طالبين موافقة جهة العمل. ما أدري شو أسوي صراحة.
بدك تأخرت شفت البيشن حاطينها بيشن إني ما شفتها أصلاً.
كذابة.
قسماً بالله.
Please, somebody talking, please.
No show.
Would you please, here we have a regular meeting to discuss whatever the hospital-wide prioritization is discussed, and any head of the department has his own concern about quality. It will be discussed at that higher level organization. So the voice of all the staff have been raised up through the divisional, departmental, and dental center general meeting. What is the quality improvement project that you are most proud of in your department? We achieve, what is the achievement that you find in endo or resto or bido department have achieved in quality service? Are there is improvement opportunity that you are aware of, and you give some time and space to announce or to express your feelings during the meetings, and those of higher authority encourage you to express yourself? Did your procedure in your area that require a time out if you are going to work in a surgery, or there is a communication needing time out? Are you comfortable to express yourself in that time out or not? These are the questions that, or the knowledge that has to be applied in your area, and if it is not totally applied, you can discuss it with your heads, and I am sure that all the administration in the dental center is quite keen to apply it, and our organization have been accredited 3 times, as I have said, 2015, 18, and 2021. The incident reporting, I guess all of you know that if there is an incident, that's something that is not going in hand with the standard has been happened, or any sentinel event have been happened, there is a reporting system. All the staff is trained how to report incident and sentinel event. And this reporting system is done regularly. And a root cause analysis, RCA, root cause analysis for those sentinel event have been done to know what is the root cause for this sentinel event and how to prevent it from being happened again. The sentinel event that agreed upon in Brent Sultan is unexpected death of a patient, suicide, unanticipated death of a full-term infant baby, major permanent loss of a function of a limb or any functioning body part, abduction of a baby or whatever, abduction of some patient, wrong site procedure, infant sent home with a wrong parent in case of rape, or adverse drug reaction that happened to any patient taking medication or anesthesia. This is a sentinel event that has to be immediately reported to the higher authority to taking an immediate action and to be considered. And this is the Arabic version about the sentinel events. And the near miss is another event that if it will happen again, it will harm the patient. So you have to make a root cause analysis for it, not immediate, but within 72 hours to find out what is the root causes and to take an action to prevent it from being happened again.